So today we'll try to make a bit of a difference between what is open and what is percutaneous endoscopy, because endoscopy is quite a spectrum of interventions nowadays, and everything is endoscopic. Nothing is anymore, wide open incisions. We'll try to differentiate what is percutaneous endoscopy as a technique and realize that they're not all the same interventions, and that's why we don't have the same complications. And basically at the end, trying to draw conclusions, what is best and what we should do. I think this is a very important slide that I present all the time, because many years ago, we stopped doing interventions here, where is needle placement and doing RF and so forth, and if nothing worked, patient moved up the ladder, going to open surgery. And nowadays, we have in our group neurosurgeons and orthopods, and basically we see about 150 patients a month, and rarely, maybe once every 3 months, we have patients moving up to open surgery.